Welcome to the Respiratory Emergency Station, which is part of the Medical Emergency Skill Sheet. In this station, you should listen fully to the scenario and briefly look at the material provided for you. Don't let the material in the station mislead you. If you need something while you're in there, ask the examiner for it. Ask any appropriate questions to the examiner up front. And as always, remember your BSI and scene safety. Good luck. BSI, scene safety. How you doing? I'm Gary from the ambulance. What seems to be the problem?
I'm having a lot of trouble breathing.
Okay.
Asthma.
You have asthma?
Yeah.
Okay. How long has this been going on for?
About 20 minutes.
Okay.
Yeah.
All right. And this is the only patient. You're the only patient here. There's nobody else that's affected. Okay. I'm going to start an ALS intercept because I think that we need that level of care for this patient. You didn't fall at all?
Mm-mm.
Okay. What's your name?
Lindsay.
Lindsay, I'm Gary. Nice to meet you. Okay, so I'm not going to have to worry about stabilization of the spine. My general impression of this patient is an asthma patient who's having difficulty breathing, and we're going to start to assess her appropriately. She's conscious and alert. Do you have any chest pain?
Just tightness.
Just tightness?
Yeah.
Okay, all right. And you said that's been going on for how long again?
20 minutes.
20 minutes.
Yeah.
I'm going to go ahead and start you on some oxygen, okay?
Mm-hmm.
I'm going to give you 15 liters per minute of oxygen. Your non-rebreather mask. Okay, great. Okay, just take nice slow breaths with that, okay? Great, all right, and I'm going to go ahead and check your pulse.
Heart rate is 90.
Okay, your heart rate's 90. We're going to transport in a high priority for this patient. I think that she needs a ALS intervention relatively quickly. What were you doing when this started?
I was out in the garden.
Out in the garden?
Gardening.
Okay. And has this happened to you before?
Yeah, I've had asthma attacks.
All right. Is there anything that makes this worse or makes it better for you?
No, this is the worst attack I've ever had.
It's the worst attack you've ever had. Okay. Did you do anything to try to make yourself feel better?
Yeah, I did my albuterol, but it's not working.
Okay. All right. And how long ago did you do your albuterol treatment?
I did it maybe 10 minutes ago, and then when I first felt short of breath.
Okay. All right. Okay. So this has been going on for 20 minutes. Do you have any allergies to medications?
No.
No? Okay. And what kind of medications other than albuterol do you take?
I use Singular daily.
Okay.
And then, albuterol when
Okay.
I need it.
All right. Any other past medical history at all?
No.
All right. And what's the last thing that you actually put in your mouth before this event happened? Food or fluid?
I had a sandwich around noon.
Okay, around noon. You weren't exerting yourself or anything like that in the
No.
garden, right? Just routinely working out there? Okay. All right, I'm going to go ahead and check your vital signs, Lindsay. I'm going to start with your blood pressure. Just let me know if you have any questions or if anything changes, okay?
Blood pressure is 118/70.
Okay. I'm going to check your pulse rate again.
Heart rate is 90.
Okay, and I'm assessing the patient's respiratory rate.
Respirations are 28.
Okay. And at this point, I'm going to remove the blood pressure cuff. Auscultate her breath sounds. Okay. Lindsay, I'm going to contact medical direction. That's the doctor at the hospital, and I'm going to ask them if we could give yourself one more of those breathing treatments, okay?
Uh-huh.
All right, so stand by 1 second.
Okay.
Medical control approves the treatment.
The doctor at the hospital said that we can give you one more of those inhaler treatments. Okay,
Okay.
you're familiar on how to take that, correct?
Uh-huh.
Okay, so let me remove this. I'm going to have you go ahead and give yourself one more meter dose inhaler. Okay. Good. Let's put this back on. Okay. And we're going to make a decision to transport a high priority with an ALS intercept. I'm going to continue my detailed physical examination on the patient. I'm going to repeat my initial assessment. On the way in, I'm going to repeat the vital signs. I'm going to ask Lindsay to tell me if she has any changes in the way that she's feeling or acting right now. And I'm going to repeat our focus assessment on the way in. I'm now done with the station. Takes or verbalizes body substance isolation precautions. Scene size up. Determines the scene is safe. Determines the mechanism of injury or the nature of illness. Determines the number of patients. Requests additional help if necessary. Considers stabilization of the spine. Initial assessment. Verbalizes general impression of the patient. Determines responsiveness and level of consciousness. Determines chief complaints and apparent life threats. Assesses airway and breathing, including assessment, indication of appropriate oxygen therapy, and assuring adequate ventilation. Assesses circulation, including the assessment and control of major bleeding, the assessment of the pulse, and the assessment of the skin, color, temperature, and condition. Identifies priority patients and makes transport decisions. Focused history and physical examination or rapid assessment. Signs and symptoms. Assess history of present illness. Onset, provokes, quality, radiates, severity, time, and interventions. Allergies. Medications. Past pertinent history. Last oral intake. Event leading to present illness, rule out trauma. Performs focused physical examination, assesses affected body part or system, or if indicated, completes rapid assessment. Vitals. Obtains baseline vital signs. Interventions. Obtains medical direction or verbalizes standing order for medication interventions and verbalizes proper additional intervention or treatment. Transport. Reevaluates the transport decision. Verbalizes the consideration for completing a detailed physical examination. Ongoing assessment. Verbalized. Repeats initial assessment. Repeats vital signs. Repeats focused assessment regarding patient complaint or injuries. Did not take or verbalize body substance isolation precautions when necessary. Did not determine scene safety. Did not obtain medical direction or verbalize standing orders for medical interventions. Did not provide high concentration of oxygen. Did not find or manage problems associated with airway, breathing, hemorrhage or shock, hypoperfusion. Did not differentiate patient's need for transportation versus continued assessment at the scene. Did detailed or focused history, physical examination before assessing the airway, breathing, and circulation. Did not ask questions about the present illness. Administered a dangerous or inappropriate intervention.